Ucesco Africa is a charity non-governmental organization that is committed to supporting vulnerable women, youth and children in marginalized communities of Kenya through education programs, healthcare provision, and micro-business agricultural support by empowering the most vulnerable in the community.
Ucesco Africa was founded in the year 2010 but was officially registered in the year 2014 by Kingsley Nyandika, and it operates in marginalized areas. And these marginalized areas are basically the slum areas and the arid and semi-arid areas in Kenya.
Ucesco stands with the three pillars, that is education and development, health and empowerment and agriculture as one way of eradicating poverty. What I used to hate most is to come to you every time, like you help me with food, then again tomorrow I'm coming to you asking food. So for myself, I used to feel shy. So if you give me 100 shillings, I don't want to come back to you. So because of that one, I felt like now Ucesco, we can do it, we can approach this issue in a different way, in a very sustainable way.
Guided by its objective of alleviating poverty in communities living in marginalized areas within Kenya and tied to SDG 1, Ucesco Africa builds intercultural understanding through heritage protection, support for cultural diversity, and human coexistence irrespective of one's religion, race, ethnicity, or gender.
Jambo, jambo.
There is no doubt that families and individuals within these communities, a majority of them living under the $2 a day poverty line, desire for a change in their lives, food security, education, social security, and good health, which in most cases is a luxury to many of them.
Life in Kibera, it's not well because it is a slum. We are mixed up. Even laying a food to the table is a problem. Even to get a shilling, even 5 bob is a problem. And when I am suffering from high blood pressure, it's too difficult for me to get even medication. We have to cope with it because that's life. But you have to struggle for a living. Sometimes even you go looking for a job. Like me, I don't have a job, but I just go around looking for something to do, washing clothes for people. Sometimes I get even 200 shillings or 300. To manage the situation is too hard because the rent is there. I'm a single mother. Sometimes it's hard for me.
Many other times, they lack enough resources to access good and affordable healthcare services, leaving them vulnerable whenever diseases strike.
Like most of them, they can't afford to go to the hospital. So what's happened? Somebody just sits in the house, continue taking painkillers, and then we have lost some of them because they were not able to be checked in time. That's why now also in Ucesco we always give them that chance of free checkup and also free treatment.
It is against this backdrop that Ucesco Africa, in collaboration with the Citadel Military College of South Carolina, recently organized major free medical camps in Mathare and Kibera slums to help the poor and vulnerable populations here get access to free and quality medical services.
We have the medical camp like we do annually, whereby we invite doctors from all over the world.
We've partnered with Ucesco, and Ucesco's been an invaluable part of this entire experience. They're the ones who've given us a lot of the connections, not only with the Kenyan government, but also with other folks around and other organizations around to be able to help with this project. So the Citadel, in collaboration with Ucesco, has been able to pull all of this together and to organize this and to strategically set this up in a way that where we know that we can be successful.
These two slums are the largest and highly populated informal settlements in the outskirts of Kenya's capital, Nairobi.
The medical camp was in Mathare and Kibera. 1 week in Mathare, which was the first week. The second week, the medical camp was taken to Kibera. So in Mathare, the medical camp, in the number of people that were attended to were 3,000 plus. And in Kibera, actually the same. The medical camp took a full hospital setup, from the triage to consultation to the pharmacy, and the extreme cases were referred to hospitals for better treatment and further consultations from other doctors.
To the beneficiaries, this was an answered prayer.
Mimi naitwa Joseph Kamau Mwaura, mkaaji wa Mathare 3B slums.
Naishi Mathare 3B.
I live in Nairobi, Kibera, Linti.
Nakaa Lindi, Kibera.
Naishi Lindi, Kibera. The planning and organization of these free medical camps was also a dream come true for Ucesco Africa, an organization that work and interact with these communities on a daily basis and not only experiences but also understands the challenges they go through day in, day out.
We chose Mathare and Kibera because Kibera is one of the largest, actually the second largest slum in Africa after Soweto. Then we went to Mathare. We chose Mathare too, simply because some of our projects are situated in Mathare and we could be able to reach most people there.
There's a need for medical services, especially to the vulnerable community in Kibera. We just trying to complement what the Ministry of Health is doing, who are also the main partners on the exercise that we are doing now. So there's the level of poverty, the level of access to health, and the level of quality health services to the community is what pushed us to have this medical camp together with the Citadel.
So the medical camp was an uphill task, especially in the planning of the medical camp, securing other partners apart from the Citadel team. But I can say it was a success since we got different partners from Beyond Zero Nairobi, Nairobi Metropolitan Services, Nila Pharmaceuticals, Jomac Pharmacy. So this was a success despite the challenges that came in with finances, securing a ground, but it was actually great in the planning.
During medical camp, I was in charge of coordinating the community health volunteers to do the home visit and come up with the critical medical cases that needed doctor's intervention.
I was visited by the director of Ucesco Africa, Kenya, having been brought by one of our community health volunteers who deemed it necessary that this community be given medical camp because of lack of drugs in the facility and lack of drugs in the sub-county. When the director visited me, he explained what he was coming to do with us, and that became something of sense to me, and I allowed it. So we together partnered to make the camp work. I allowed community health volunteers, about 6, to go into the community and mobilize to tell the community that this camp will be on for 5 days.
It is through vast experience and great working relationship with the community, friends, counties and national government, as well as international friends, that Ucesco Africa set out a plan on how to reach all her friends for the success of these free medical camps in informal settlement in Nairobi.
I was most obliged to have worked with the Ucesco Africa and Citadel University of South Carolina. They came in at the right hand, especially this time when we didn't have medicine in the county. We were less of medicine in the county. And they came and did most of their work in the most affected areas. One in Mathare slums and Kibera slums. It was of great help. I would say this has never been in the first beginning. We have always done medical camp for 1 day or 2, but this one we went for 5 days in Mathare Bethany College, and then we went to Kibera for 6 days. It was such amazing.
We've been collaborating to design this medical camp, and now this medical camp has begun. Our goal is to have a high impact on the communities of Mathare and Kibera. This is really important. We want to be able to serve the people and provide healthcare to those that don't really have access to healthcare very easily. So this is really important.
The camp, which took a full hospital setup of consultation points, triads, treatment and chemist sections, saw thousands of people with different medical problems and conditions come forward with a lot of hope of being attended to by the various medical professions present.
The purpose of the camp is to be able to provide a service to the Kenyan people in various capacities, mainly in medical. So we have various stations set up here. First of all, we're going to register the folks, then we're going to triage them to see what's going on, ask them what's happening to make sure we separate the medical emergencies that need to be dealt with right away, as opposed to others that might need physical therapy, that might need antibiotics, that might need some form of a treatment, and figure that out in the triage portion. And according to that, we will send them to the various stations. So we have a lab station, we have testing stations and things like that, to sort of rule out some of the issues that some of these folks might be having. And at that point, when we figure out if they don't need any diabetes medication or if they have some form of hypertension or something else going on, then we know exactly how to treat them.
It's been my absolute honor and pleasure to be serving the communities of Mathare and Kibera. Today we have set up our camp for phase 2 in Kibera. We hope to be here for an entire week. We are able to provide services for medical treatment as well as dental treatment. We have a physical therapist. We have an affiliation with sonogram facilities which we can send our patients to. So we have an entire pharmacy with pharmacists employed, and we are able to give out medication as well for all the treatments that are needed.
The doctors, on the other hand, did all within their reach and knowledge to diligently see and attend to as many patients as possible, with extreme cases being referred to reputable hospitals for further checkups and treatment.
My name is Robert Nyananga. I work for Ucesco Africa, and now we had a medical camp here at Bethany Christian Church, and a lady came here with a child suffering from hydrocephalus, and Dr. Sarah Imam, who was leading the Citadel delegation of United States of America, and Dr. Lee recommended that the lady be observed at Kenyatta Hospital.
My name is Purity Nzisasengo. I have 20 years old. I learned about Ucesco medical camp through my uncle. My daughter is 11 months. She cannot sit or stand. When I came with my sick daughter, they treated her and referred us to Kenyatta National Hospital.
I was appointed to be in charge of this case, so I'm taking her to Kenyatta National Hospital this morning, see that she gets assistance.
Before I visited the medical camp, I was blind. My eyes could not see, and I had lost hope. My family did not know what to do because I'm with my family here and I'm the breadwinner. They were just crying because, fortunately, when I went to the camp and the doctor started handling me, when they gave me the first dose of medicine that I had to take, That week, as my eyes opened a bit, I could now see. Before that, I could not read anything, but thereafter I started reading letters, bold letters I could read. So I've improved a lot. I've improved. I could not come from here to town or to Kenyatta alone. Somebody had to take me.
The second week of the medical camps took the team to Kibra slums, and just like in Mathare slums, the populations here came out in large numbers for the free healthcare services.
Mimi naitwa Janeti, mwenyewe kutoka Kibra Lindi. Nimekuja hapa sababu ya matibabu. Tuliambiwa na MC mwingine anaitwa Talipani. Ana combine kiti ya MC ya Lindi. Alafu katuambia kuna matibabu bila pesa. Sasa ile nilikuja ngaundumiwa na madaktari, wakanitunga sindano makoti, wakanipatia dawa, wakanifanyia physiotherapy. Sasa nasikia sawa, nashukuru Mungu.
Both the young and the old with different medical issues filled the ground and patiently waited to be attended to by the team of doctors.
Nilijua hiyo medical camp through posters, na juu nilikuwa mgonjwa nikaenda huko kutibiwa. Kufika huko wakanipima, wakanipata niko na pressure. Kwanza wakanitibu pressure, nikapona, nikasaidika sana. Madaktari walikuwa wazuri, walikuwa very happy, na dawa zao zilikuwa smart sana, nilifurahia.
Nilikuwa na ugonjwa wa sukari, nilikuwa na ugonjwa wa kifua, na ukweli ni kwamba walienda wakanipima, na baada ya hiyo wakanipatia dawa. Na saa hii naendelea kumeza hiyo dawa, na sisikii kama vile nilikuwa nasikia wakati ule.
Nilisikia hii huduma ya matibabu inakuja hapa Kibra kupitia kwa watangazaji wenye walikuwa wanatangaza kwa barabara. Nikachukua nafasi yangu kwenda kuona kama nitasaidika. Nilipofika hapo nilipata usaidizi. Nilikuwa na ugonjwa wa kifua na nikakuwa na ugonjwa wa meno, but niliweza kung'olewa meno na nikapewa madawa. Kwa saa hii naendelea kusikia vizuri, na nawaomba tu muweze kurudi, tuendeleze watu wengine waweze kusaidika kupitia hapo.
We've enjoyed every single moment, both in Mathare and Kibera. We feel that the most important thing was serving the people of these communities. We've seen thousands of patients, we've referred many hundreds, and we hope that our work will have a lasting impact.
The 2 weeks of Kibera and Mathare free medical camps were a big success story that Ucesco Africa and its partnering friends highly appreciate and would love to see happen time and again.
It's important for everyone to know that everyone that has been involved in this medical camp, from donors to advisors to people in the board, you've all played a very, very important and vital part in making this successful.
On the other hand, the residents of Mathare and Kibera slums were so grateful, happy, fulfilled, and wished the medical camps would stay for much longer so that more of them would benefit from the good services offered.
Nashukuru kwa sababu tumepata hizi dawa zinachukua kwa nazo. Arudishe tena na arudishe tena.
Nimekuja huku leo around saa 2 huku nikahudumiwa, nikapata huduma mzuri. Nilikuwa na shida ya magoti kwa muda mrefu na joints zilikuwa zinauma, but nimehudumiwa, madaktari wako sawa, wakaniangalia, wakanipima hata damu na wakanipea hata dawa. Na nimeshukuru sana.
Since then, I feel now better. I went to the labs, they checked me very well, they treated people well, so I'm happy for them. Ucesco, I wish you to come back, because there are some people, they didn't manage to come, because we are many people who are suffering in Kibera slums.
From the facilitator's standpoint, there were several take-home lessons learned from the free medical camps that would be of great help in the future and for the healthcare institutions in the country.
We hope that we can continue this work, and so your continued support and efforts are really important.
I'm a physiotherapist by profession, 8 years of experience in my profession. Most of the patients that we're seeing currently, they have financial constraints. They're not able to afford physio. Most of the patients here, they don't know what is physio. So it is a good leeway for us as Citadel and Ucesco and Kenya itself as physiotherapy. We need to create awareness of the need of physiotherapy in the society.
My name is Michael McDowell, and I'm here in the physiotherapy room, and I'm from the Citadel. And so I'm here just to really help out the people of Kenya and to increase my experience here with hands-on experience while giving medical treatment to these people. We've seen a ton of patients so far that are here in this camp, and I don't think that these people would have received the treatment that they deserve if we had not come to this, to Kibera and to Mathare. And I think without this camp, just a lot of people would be in need, and I think this is a very beneficial thing that's going on here.
It feels good to see our patients alleviate their symptoms, treat their condition. Some of them might not have the means to acquire the drugs that they need. So here in this camp, we are providing those drugs, and they live happy. We've seen quite a few challenges that the community is facing, and we are able to help them get the drugs they need. We even prescribe 2 months, 3 months of worth of drugs. And they go home happy because on normal occasions they're not able to afford these drugs, and they stay for a long time without taking these drugs and end up getting complications of hypertension, diabetes. So I feel the part we are playing here, not just me, but all of us, doctors, nurses, pharmacists, we're definitely benefiting these communities.
I just think this is something really important that we're doing, and really something that you could see that is needed in this community, whether it's Mathare or here in Kibera. It's just something that people don't take for granted, and I think that's really valuable for the people here and for us as medical assistants.
Well, I've been working with Ucesco for a year now. I've started my own project here called the Saving Lives Educational Program, where I teach high schoolers in Kibera different subjects in healthcare. I have weekly Zoom meetings where I bring doctors from the US and they teach the students.
So we've seen a lot of things that have been caused predictably by malnourishment and lack of water, that type of thing. We've also seen some trauma that's gone untreated for a good while that should have been seen sooner.
Right, so I think a big thing that we've seen is that a lot of people here in Kenya have very flat feet. And so that is not a very common thing in America. And so that leads to a lot of problems like related to sciatica, running up the leg from the lower back all the way down to the feet, and numbness and tingling in the feet. And so I think a lot of it has to do with the footwear they wear, and they're walking around a lot all day. And so you see that in America, but it's for different reasons. So most of those problems when you see sciatica in America is mostly from sitting down all day and kind of resting and not being mobile and active. But a lot of people here in Kenya are very active and they're very mobile, but they have very flat feet and they wear not proper footwear. And so that leads to extra problems with sciatica, and that's just something that you see more in Kenya and less in America.
Yes, I'm very happy that we have reached a good number that needed these services. That is very vital. And I believe that we achieved our set targets and goals, and we expect to make it better next time, God willing.
I think we have done more than 10,000 people. In Mathare, we did about 5,000. And by yesterday, I think I was talking to my chairman, the president of Ucesco, Mr. Kingsley Nyandika, who was saying that by yesterday we had actually done 5,000 people here in Kibera, Lindi.
First, I want to appreciate the partners and shareholders who have taken part in this exercise, and I also want to challenge and encourage more organizations and institutions who want to work with us in this journey based on the mission of Ucesco, that is apart from health, cutting across to supporting the community needs and the schools, education and all that.
My message to the Citadel is thank you. Thank you for letting us have this amazing study abroad program experience. I am speaking on behalf of the entire team. It has been overwhelming in every single way. I think it's really certainly opened up a whole new world for all of our students.
Thank you, Ucesco and Citadel University, for your help.
Asante sana Ucesco.
Asante sana Ucesco na Citadel. Tunawashukuru sana.
Ucesco and Citadel doctors really help us. And many people, when I saw the camp that was at Madari and the camp that was Kibera, there are thousands who are suffering. They are suffering, but because they cannot meet the cost, they cannot go to hospital and get treatment. I, being one of them, I know there's thousands of people who are helped.